So, you're ready to use your Scientia Dermaroller. Well, you should bear in mind that there are two methods of use for the Scientia Dermaroller. One version involves the use of topicaine gel to numb the area, followed by a more aggressive use of the Scientia Dermaroller once per week. The second alternative involves using the device with a slight pressure up to 5 times per week. Using the device gently gives a tickling feeling and is not painful, although your facial area is more sensitive to it than your body. Neither method should draw blood. You may feel a temporary reddening of the skin for an hour or so after treatment, and it can give a sensation similar to mild sunburn. We recommend the use of sunscreen or sunblock after use if this persists. Now, before you begin, you want to establish a sterile environment. That is, that you want to ensure that you wash your hands and the area to be treated thoroughly prior to using the Dermaroller, and then dry them with a clean towel. Then, using disinfectant, clean your treatment table and lay out the following items: your Scientia Dermaroller, a tube of topicaine gel, if used, antibacterial cream, a bowl of iced water with a washcloth in it, a clean towel, some paper towels, a glass containing some disinfectant, a good quality facial or body moisturizer, and a timer or clock. If using the Scientia Dermaroller on your face, do not use on the eyelids or lips. Firstly, wipe off the excess topicaine gel, if you're using it, with a paper towel. Afterwards, roll the Scientia Dermaroller over the area in question several times in different directions. 4 rolls vertically, horizontally, and each diagonal is more than enough to stimulate collagen formation in the skin. Do not press too hard, as this is not necessary for excellent results. If you are using the numbing gel and are more vigorous with the Scientia Dermaroller, you may experience a reddening and rawness of the skin for up to a couple of days after use. If you are more gentle but use the device regularly, the same results can be achieved with much less trauma to your skin. Reddening only lasts for a few minutes. If you are using the Scientia Dermaroller for hair loss, thinning hair, or grey hair, each morning or night after showering and washing your scalp, dry it well with a clean towel. Then, roll the Scientia Dermaroller over the scalp in one direction, not back and forth, and apply 1 milliliter of 5% minoxidil, which should be available from your local pharmacy, to balding areas and massage into the scalp thoroughly. If you notice the scalp flaking after a few days, simply rub the dead skin away while shampooing your hair. Treat no more than once per day, 5 times per week. After your treatment, wash the treated area with cold water, dry the skin gently, and apply moisturizing cream. If you have used the numbing gel, use an antibacterial cream first, shortly followed by a moisturizer. If used gently without the numbing gel, go simply straight to the quality moisturizer, preferably one containing vitamins C and E, as using the Scientia Dermaroller greatly increases the absorption rate of these nutrients. Visit our online ordering page to buy cream online. Finally, once you have finished with your Scientia Dermaroller, be sure to care for it properly. When you've finished using the device, rinse the roller under hot running water. If you have used the roller with a numbing cream, stand the head first in a half-full glass of disinfectant for approximately 30 minutes to 1 hour, but no longer. If you only use the roller gently, you will only need to disinfect the device on a weekly basis. Shake off the excess liquid and stand on a clean towel to dry. Please do not put the device away while it's still wet. When it is completely dry, replace the plastic cap and store the roller in the plastic tube provided. Please try to keep the case clean and store somewhere safe so that the device cannot be damaged between uses.